There's another company out there, Nektar, that's making a pegylated interleukin-2 formulation in NKTR-214, and it's got some ambitious plans. Tell us a little bit about that.
So yeah, the NKTR-214, it has a name now that's many letters. So bempeg-aldesleukin. So you know, IL-2, high-dose IL-2 was aldesleukin. So this is bempeg-aldesleukin, or NKTR-214. So this is a Pivot-09 trial. That's a phase 3 trial. It's going to be in the US, but mostly ex-US. China, Russia, Latin America, Mexico, Australia. So I think, Dan, you're on the steering committee with me. And so it is comparing NKTR-214, the pegylated IL-2, plus nivolumab, based on already positive results in the Pivot-02 trial, phase 1/2 trial, versus a TKI, a dealer's choice. It's a cabozantinib or sunitinib. In the US, where cabozantinib, and other countries where cabozantinib is approved for first-line therapy, the TKI will be of choice, will be obviously cabozantinib. In countries like Russia, China, where the cabo is not approved for first-line, it'll be sunitinib. So it's the two co-primary endpoints for this 600 patient phase 3 trial is ORR and OS. And you start with ORR first, and then OS will be the second interim analysis. So we'll see. I think it is a novel mechanism of action because it's different than the high-dose IL-2. And in the phase 1 trial, Pivot-02, that we have conducted in many cohorts of different tumor types, melanoma, RCC, bladder, lung, and others, what we have seen doing biopsies on these patients at the phase 1 pre-treatment, so baseline and 3 weeks after one infusion of the drug, is that this drug is the best T-cell recruiter. It brings T-cells, CD8, into the tumor microenvironment, and in many patients converts PD-L1 negative tumors to PD-L1 positive tumors. So I think it is definitely a new mechanism of action agent. So, and we'll see if the trial will be positive in RCC. I hope it will. For the sake of our patients, we'll have a new therapist for them. At this ASCO meeting, there is a poster. Hurwitz and colleague are presenting data on biomarker with NKTR-214 plus Nivo. In melanoma, in metastatic melanoma, this dual, this combination of NKTR-214 and Nivo produced 34% CR rate. And I think this is an impressive CR rate with very favorable safety profile. So I think it is a deliverable combination. It may have comparable efficacy to Nivo-Ipi, but probably with a better safety profile. So I think this is an exciting phase 3 trial that is in the first line setting, and it has opened, and we have already enrolled a few patients. So I'm looking forward to really seeing it complete its target accrual of 600 patients, and then many sites, joining.
Mm-hmm. And probably more versions of that drug in combination with other strategies in the future. And then there's one other study I'm told is similar to the pedigree study, a nivolumab, ipilimumab study plus or minus cabozantinib.
Yes, that's the COSMIC-313 study.
Yeah.
It's a sponsored trial by industry, by Exelixis, and it's actually builds on Nivo-Ipi as the backbone. Mm-hmm. So it's for patients with intermediate risk, poor risk. Patients are randomized to Nivo-Ipi plus cabozantinib at the dose of 40 milligram per day, and Nivo-Ipi is given at the standard dose and schedule like CheckMate 214, versus the comparator is Nivo-Ipi plus placebo. And the primary endpoint for this 676 patient phase 3 trial is PFS. So again, the trial is just launching, has I think launched and already enrolled a few patients. We'll see those two trials will be going in parallel, and we'll have probably results in 2021 from COSMIC-313 and the Pivot-09 trial.
So there's a lot to do. We obviously gonna, as to Bob's point, we're gonna need patients to fill all these trials, and I think we're not gonna get it done without the community help, and hopefully opening these studies up in more and more community research centers, and I hope we can get it all done.